what's up, everybody? This is Maggie Reichard, and you are listening to Nursing Uncharted, the podcast that talks about all the different types of nursing here. Thank you so much for listening today. If this is your first time listening, welcome. We're so happy to have you here. And if you're a serial listener, thank you so much for listening today and previously. We really appreciate your support. We are always interested in hearing from listeners about what they think of the podcast, and we love tailoring episodes to what you guys want to hear about. So if you have a realm of nursing that you're interested in, please let us know. DM us on Nursing Uncharted and let us know what you guys want to listen to. So today we have a great episode. It's a type of nursing that we've probably all come across at some distant point in our lives, and that is school nursing. I remember my school nurse in elementary school as one that gave me like a little tiny treasure chest to put my tooth in when one of my teeth fell out in school. That's what I remember from school nursing. They're near and dear to my heart. So here to tell us the ins and outs of school nursing, as well as some of her stories, is Saoirse Cummins. Saoirse has been a nurse for about 5 years. She's worked in a myriad of different environments, hospital staff, as an agency nurse abroad in Australia, and as a travel nurse within the US, which is where I met her. Now, Saoirse has found where she fits as a school nurse in Wisconsin. Outside of nursing, she can be found painting terracotta pots and hanging out with Hashbrown, her corgi pup, and Weasley, her 10-week-old kitten. So, Saoirse, welcome to the show.
Hi.
I'm so glad to have you here.
It's great to be podcasting with you again.
I know. We've podcasted before, so
it's gotten a little more official, but...
Yes, it certainly has. I know. It's been a while. Well, actually, I saw you back in November at my wedding.
Yeah, when you finally got to have your wedding.
I know. Wouldn't recommend a COVID wedding.
I can imagine, but it turned out great.
Yeah, it did. It did. Well, thank you for coming on to talk about this realm of nursing. I'm sure it's very different than what you are used to in the hospital.
So different, but like in a good different.
Yeah, for sure. So how long have you been doing school nursing now?
I started in December, so they had somebody doing it who left and was like, "Hey, want to do this? I know you hate the hospital right now." And I was like, "Sure, I'll try anything." And that's how I did it.
Who is that person that gave you like the in?
A coworker actually that I worked with at the hospital. And then she got a completely different job. Like she actually does like cruise ship stuff, but she couldn't do school nursing and cruise ship stuff, even though one was supposed to be working from home. And she thought she could do both at the same time. Didn't work out and was like, "Hey, I know you want an out." And just dangled the carrot in front of me.
And you're like, "Oh, that sounds pretty great right now."
Yeah. I was like, I can't look at another patient's wound or listen to another doctor tell me one more thing. I'm so in.
How long were you traveling at the time, or were you permanent?
No, I was doing 2 jobs. I was working at a children's ER, like at a very strange shift. It was like 3 to 1 or 3 to 3 or 1 to 4, and I was exhausted. And then I was also working like at an adult hospital, PRN, which I kept that job for when like the school's on breaks and keep up my skills, and just in case I wanted to like jump ship,
pop back in.
We'll keep that job.
Gotcha. I think I've said this before. I've always been like a 36 hours a weeker. Like I cannot imagine like working the two. I mean, I guess I have 2 jobs right now, but like working like 48 hours a week or more, like
I just 10 out of 10 would not recommend.
Yeah. Okay.
But with school nursing, I work only 6-hour days. Like I'm not there for their full school day.
Oh,
so it still adds up to be like, I don't know. You have less time off than when you work 3/12s, but I still have time off now. It's just like structured. Like every day I'm done at this time. So that's my time off, as opposed to like, oh, you have Tuesday off this week, but Friday off this week.
Sure. So what do your hours normally look like then? Like from when to when?
From like 8:30 to 2:30 or 8 to 2, around there.
Okay. Is that like normally when the kids go home, or you
They're
just...
done at 3, so I finish like a little before them, and it's really nice because then I can like get out of there before they're all outside waiting to be picked up.
Screwed out of there.
Screw it, before the pickup line starts wrapping the school.
Yeah.
Because they don't have buses because it's a private school, so like it literally is a long line of parents picking everyone up, and I made the mistake of staying late once, and I was like, oh no, I'm in the pickup line, I don't have a child.
Oh no. Yeah, you were telling me before. So tell me a little bit about like the type of school. You said you're at a Waldorf school. Mm-hmm. How is that different?
It's not a public school, it's a private school. However, the one that I am at has like a program with the local public schools and like community that if you make below a certain income level, you can opt out of the public school and like technically qualify to go there instead.
Oh, cool.
So we do get kind of a mix, but a lot of it's private school kids. And the Waldorf is it's like a philosophy of teaching. So they do like thinking, feeling, doing. They teach to learn, not to test. Like, I don't think they do any standardized testing. There's no computers in their classroom. They don't do technology. They do like woodworking and knitting, and they have outdoor enrichment teachers.
I love that.
They just get outside and do so much hand stuff. So it's really cool. I never even really knew it existed until I started working there.
Oh my gosh.
And it definitely brings like a different kind of pupil and then their families to the school. But
oh, for sure. Do you feel like that kind of like philosophy setup like affects your job in any way? Like, do you think it would be different than like any other type of school doing a school nursing job?
I'm not sure. I mean, the first day I was there, when I opened up the medicine cabinet and saw all of this like homeopathic stuff I've never heard of, I was like, oh boy, I have a lot of Googling to do because I can't give this to a single kid. Like, I don't know what it is. It's
oh my gosh.
probably safe, but I don't know what it is.
Yeah.
And then
so have
there's
you
just
learned
less sick kids, I guess, too. Like, nobody really with chronic illness because besides me, there's no one in the school to really help them.
I thought you were going to say, besides me, there's nobody else that's chronically sick.
It's just me.
It's just me. I take a lot of that homeopathic stuff that's in the cabinets. Yes, right. Oh, that's really...
I'm still sketched out by some of the stuff in that cabinet, I can't lie.
So have you learned, like, I mean, what's like some of the stuff that you use from there?
I think the big one is this cream called Arnica, which is like to help with bruising and pain and stuff. And then the rest of it, I'm like, I don't know about this. Here's an ice pack. We'll stay away from the creams. I'm not too sure about.
Good old ice pack.
They do have like a little lavender one for like calming.
Cute.
That sometimes gets used, but.
So what are some of the kids that you normally see?
Because we don't have like that many complex like pupils in the school. Because I also found out from being a school nurse that public schools can get like health room or like health aides. So instead of like having your classroom aide, like when we went to public school and it was like the teacher and the teacher's person that bopped around and helped, you know, the special needs kids or whatever. If you have diabetes in a public school, you can apply for like a health aide who like for younger kids goes in class to class and like helps them manage their diabetes. So we don't really have like too many of those students, but we do have like a couple EpiPens in the cabinet for kids with allergies. All kids get allergies. Some inhalers. There's some kids with asthma, and then I do have a few students that have like timed meds for their like ADHD throughout the day.
I see. Okay, so that
would be the big one. It's like ADHD and it's timed. I have to have a reminder every day.
Do you have to go and find the kids, or do they come to the office?
We started with them coming to me and then found that I was actually more disruptive for them to leave class and come back every day. So now I just go find them.
Gotcha.
Because I just pop in. They know the drill. Their classmates don't even pay attention to me anymore. But like them coming down every day, especially because it's kids with ADD meds, they would take forever in the hallway. They'd be doing all kinds of other things. Their teacher would be walkie-talking me like, hey, where are they? And I'm like, I sent them back to class. I don't know. So
taking the long way, the scenic route.
So they stay in the classroom now and I go to them.
Okay. So I guess for like inhalers and EpiPens, like they normally have to, parents bring all of those things for like a set.
Yeah. So it's like a very regimented, even for passing meds, like a lot of the kids have to get 2 scripts, like one for school and one for home, because it has to be in its original container with its label. All this paperwork has to be done. Same with the inhalers and the EpiPens. However, a lot of those are kept actually in the classroom so that they're with the student.
Okay.
But then if they need to give the inhaler, they'll just consult me first. I've never had to give the EpiPen yet, but I would hope that the teacher would just do it without me.
Yeah. Right. You would hope that they would have,
but it's not
like,
a huge
training.
school, so I can run fast.
You can run down the hallway. Do they have do they just have like cord phones, or how do they like get in touch with you?
We have walkie-talkies. It's a really old building, and it's like 3 stories. Old building. So we walkie-talkie each other.
Okay. Well, that's pretty quick.
Pretty quick.
Yeah. So what is your, walk me through kind of a typical day, 8 to 2:30.
I come in, I open up my health room, set up my stuff. I also, this year, have been COVID testing because I have a contract to do that, but that's ending. So I don't think that'll be a part of my job next year unless they fill the needs. So I normally set all that stuff up first, so it's just ready to go. And answer emails, deciding like, oh, you're sick with this. Do you have to quarantine? Can you come back? Do you need to get a test to come back? Are you okay? That's like the biggest part really this year, is determining who has to stay home and who can come to school.
Oh, okay.
Or how long you have to stay home. Like, oh, your sibling in high school who doesn't go here was positive, but you live together. So do you get to come back to school, or what the deal is? So I do that, and then I wait for someone to walkie-talkie me.
Wait for something to go down.
Yeah, and I mean, some days nothing goes down, and I have come up with some interesting hobbies to do in the health room. And other days, it's like nonstop.
Yeah.
And with it being school's almost done, the last couple of weeks have been nonstop and obscure. I'm like, what is going on? What is going on? I don't think I was that wild, but I guess we must have been.
Like, what kind of kids, like, are they trying to skip class and they just, like, don't want to be in there?
And then the same way, like, kids have programs for, learning. If they are health room frequent flyers, because you can start that at a young age, we have, like, plans with the teachers. Like, there's a couple kids that conveniently get headaches every time it's Spanish class or have a stomach ache for gym. And so we've been working on it throughout the year to keep them in class. Like, you already missed 2 years of school by being on a computer. Yeah. So the main goal is to, like, get you to go to class.
Yeah. Right. Okay. Is there, like, I imagine that it's pretty autonomous then, as far as, like, are you working with any, like, other nurses or other physicians or anything?
It's just me.
You. Okay.
Which is so weird that I, like, have to make my own choices and call my own shots and decide, like, are you really sick? Or, like, should I send you to, like, somewhere? Am I qualified for this? I don't know.
Do you like that? Like, autonomy?
I was, like, kind of anxious about it at first, because I'm like, oh, even at the hospital, like, there's someone to, like, shoot an idea off of, but there's not really there. However, there's a couple ladies in the office that have had raised their fair share of children that'll be like, hey, so-and-so said this, and I don't have kids, but it seems to me like they're faking, and they're like, yeah, that's not real. I'm like, okay. Especially when I first got there, because I didn't know the students. They'd be like, oh, no, they say that every week. And I'm like, okay.
Yeah. That's how I felt. I did a summer camp for a couple of years, and, like, that's been my only experience with kids. But I remember coming in and, like, all the counselors, like, knew the kids like the back of their hand, and it was very much like I was, like, being filled in on all of, like, the different personalities and temperaments, and they're like, oh, this one will just warm up to you, or this one is just, like, feeling you out,
Yep. Yeah. And they just say like random stuff to me where I'm like, can you say that to me?
What?
Can I tell you no? Like, I don't know. I'm not a teacher.
Oh, yeah, that is, like you're not. Do you have any, like, what did your orientation look like? I guess.
Very, very minimal. It was like,
Yeah.
sure, you want to do it? We need one. Here you go. Because technically, the school, I'm not like the school's employee. I'm contracted with the state. Because the state did this big thing to put school nurses back in schools because they kind of disappeared, I guess. I didn't know that, but I guess there wasn't that many of them. So there was a big push to get school nurses back in schools following COVID. And so, like, my orientation with them was the same with like travel nursing was like, do a couple stuff online and go show up to the school.
Crazy.
And the school was more like, hey, this is what we do here and this is what we want you to do.
Sure.
But there's no like rules. But, like, because I do a lot of like the quarantining policy, but who knows if other nurses are doing that or if that's just what the school has delegated to me because they were like, well, you would have more insight than, the lady that does the finances in the office would to run that policy.
Yeah. Well, that makes sense. So, like, when you're emailing people about, like, quarantine policies and stuff, are you emailing parents or you're emailing kids?
Parents, there's a template. So I just normally stick to that and fill in, like, you were sick on this day. You can come back on this day. If you have any questions, reach back out. And then the administrative director is, like, copied on all of those because especially now, like, a lot of people are really getting sick of COVID and they want to have, like, XYZ reason why it shouldn't apply to them or how they know better than we do and how there's no COVID out here where they live. So, yeah.
And it's like, well, if you're getting the email, then you most likely, I mean, you have it.
Right.
So,
questions.
It's not in your area, but you tested positive and you have it. So you have to abide by this.
Luckily, they didn't make me do the masking policy because I do get some of those emails and I'm like, let me just forward that one on because I'm not doing that deep dive.
Yeah, that one is. Are they still wearing masks in the schools?
So they still wear masks inside because technically their policy was if we had more than 3% of students, I think they decided to do it per classroom test positive, then that class would go virtual. And if it got more than like 5% throughout the school, the whole school was going back virtual.
Wow.
And we haven't had to. So they kept the masks on and then made them optional when they're outside. And just based on how the school is run, they're outside all the time. Like they have, I don't have a playground because we're in the middle of a city, but there's parks all around. So teachers will take their class to the park for teaching or they have designated spots outside that they can outdoor teach from. So it's like alleviated some of the mask tension because just take it off outside if you don't want to wear it.
Yeah.
You're outside all the time.
Right. And
I've noticed a lot of kids still keep them on outside.
Yeah. Well, like, are the rates going up in Wisconsin?
Yeah.
Do you see that? Yeah.
We kind of had it like tick up a couple weeks ago. So I think we're curving back down. But yeah, a few weeks ago it was like, oh shoot.
Yeah. Yeah, same here.
And that became the big part of my job was like, because 5th grade was going on an overnight field trip and this class was doing this. So I was like testing the whole class before they left, testing them all before they came back.
Oh, so that's your job to test them. They don't go to like an outpatient, like get a PCR there.
Since they could get this like deal to have it done at the school, I just do it.
Oh.
And I have a whole different system for that because that's technically like a separate entity, but it's been really convenient because then it's like if the kid's already registered in that system and they have these symptoms, I can test them before I send them home or test them and then call their parent and be like, hey, guess what? Sorry, he has COVID. Can you come pick him up?
Yeah. Are they like rapid tests? Do you find out pretty quickly or like?
Yeah, we do both.
Okay.
So there's rapid and then I have the capability to PCR test them if the parents want to. And then those get picked up by a courier at the end of the day. But mostly people just want the rapid. They're like, yeah, if that's positive, then we know.
Yeah. Do you have to, like, do the kids just get sent home if they have to be tested? Or do they go back to class? It
depends. Like some kids will come down and ask to be tested. Like, oh, I don't feel that good today. Can I have a COVID test? And I'm like, sure. And if they don't really have enough symptoms to qualify, them to go home and they're negative and they feel better suddenly after being in the health room for 20 minutes. Go back to class. Yeah. But some of them come down and they have like, I wish I had my sheet, but I don't. It's like if they have 2 or more of these things going on or 1 or more of these things happening, then they check all the criteria that they have to go home.
Okay.
And that's like, that policy changed a little with COVID, but the schools had this like long-standing, like, if you throw up, you got to go home. If you can't keep your eyes open, you got to go home. Like,
yeah,
we can't be babysitting you because you want to take a nap in the health room.
Yeah.
However, a lot of kids do take a nap in the health room. And if you can keep your eyes open after 15 minutes, get back up there.
Yeah. We want to take a quick break from this episode to talk about the industry leader in travel nurse staffing, American Mobile. Combining the largest network of facilities and providers in the country with top-level benefits like higher earning potential, premium health insurance, and 401k matching, American Mobile puts you in the driver's seat of your travel nursing career. Make sure to visit AmericanMobile.com today to discover a world of adventure with American Mobile. That's AmericanMobile.com, the first step towards your next travel nursing adventure. You were saying, like at the end of the year, there's like, it's been like wild. Like what type of kids are you seeing now?
So wild. Well, first of all, I mentioned that the building is very old.
Yeah.
And we had a student, I'm on like the first floor. I think 4th grade is above me. Someone threw up and it leaked through the ceiling.
Stop! Oh no!
So not only were they like, hey, can you come get this kid? He's throwing up. I come back down and I'm like, oh my God, his vomit's like leaking down the ceiling. And I went in the office and they're like, no, it can't be that. And they're like looking up and we're looking down and we wipe it off the ground. And we're like, no, it's like, that's not water.
That is, did he like throw up into a vent or something?
I don't know. I don't know. I just knew it came through the ceiling and I was like, I'm pretty sure I just went to get him from like right there. And that's like right where it's coming down.
That's so gross.
And I'm sitting right here. So if we could make this stop.
Yeah, right. Yeah. Oh, like that's not like air conditioning condensation.
Yeah. We're like, oh, it's just like this school's old. We had a pipe burst in the winter and they were like, it's probably from that. And I was like, nah, it's not water.
Oh my gosh. That must be, I mean, then, people get like, kids get like heat stroke or something outside or like just like go eat and then run around outside and then.
This kid apparently was trying to see how many push-ups he could do. Right after lunch.
You only got to do that once, you know?
Yeah. And I was like, yeah, I can tell you how many push-ups I can do after lunch. 0. And still 0 before lunch.
Yeah. You were going to say another story. I cut you off.
Oh, yeah. So I have one student that just cracks me up. He's in kindergarten. He's my favorite. He's never actually sick. He just comes in because he just is a little goofball. But a week or 2 ago, he came in and the teacher's aide that brought him in was like, I'm not really sure what's going on. And I was like, okay, like, tell me what happened. He's like, well, I found this little gem and I was so excited to show it to my parents, but I'm not excited anymore. And I was like, why? He's like, well, the gem like slipped into my body. And I was like, how did it slip into your body? And he's like, I had it in my mouth for safekeeping. First of all, our mouths are not somewhere safe to keep a little gem.
It just slipped. It just fell right into my body.
What do you mean it slipped into your body? Did you swallow the gem? And he's like, no, I didn't swallow it. It just like went down. And he's like, and now it's gone in there. And I was like, so you swallowed it. You swallowed a little gem. And he looked at me and he was like, I guess I swallowed it. I was like, okay.
Oh, no.
So you're going to have to take a seat because I got to call your dad. And he's like, okay. He's like, I'm just really not excited to show them the gem anymore. And then his eyes get so wide and he looks at me and he's like, am I going to have to puke this out or poop it out? And I was like, we're not going to do either of those things right now. So slowly roll. We're going to just take a seat.
Oh my God. He's like, you see the wheels turning in his head like, this thing is going to come out. I'm going to show them eventually.
Yeah, like, how do I do it? And like, he's such a little nut that I was like, he's going to try this right now. Right here, right now. Like,
oh no.
It was a tiny little white rock. I'm not sure if it was gravel or what it was, but yeah, his sister did inform me that he pooped it out.
Oh, good. She was at the same school?
Mm-hmm.
She's like, update. Yep. Just like
she just popped her head in one day when she was walking past. She was like, did you hear he pooped it out? And I was like, I'm so proud of him.
He was probably looking for it for so long. Like, it's got to be in there somewhere.
Oh. Yeah. Then we had to have a nice little chat about where safekeeping might be for next time.
Yeah. Not inside your mouth.
Like perhaps a pocket.
Yeah.
Or your cubby.
Backpack, you know.
Yeah. Not in your mouth.
I was trying to think of like other school nurse stories that I had, and I couldn't think of any of mine, but my brother had one, and I cleared this story with my brother before. But he used to have Herbst appliance, which is like I guess it's like the modern headgear. Like it's like it was like attached to your braces, but it was like this appliance that I think fixed like overbite or underbite. It was just this like metal bar that attached your top teeth to your bottom teeth. It was like this like little, I guess, retractable like bar. And he was in elementary school. I think he was definitely in elementary school. And he was in class and he yawned and it locked in place. Oh. So
stuck open
and he was just in class like could not close his mouth.
Poor guy.
And I guess
like, hey, can you close your mouth back there? No, I cannot.
Couldn't say anything. I think he raised his hand and he wrote on a piece of paper, "My dad knows what to do." And so I was like trying to figure out, he said he didn't know if he went to the nurse's office or not. He just knows there was a lot of adults around like trying to figure out how to close his mouth.
Fix it?
And my dad had to come down from DC, from work to like come and like help him close his mouth.
Come and fix it. Like my dad knows what to do, guys, just call him.
But I think he thinks he figured it out before he was able to like, I don't know, there's like some contraption you can fix it. He like fixed it with his tongue or something, and he was able to close his mouth. But yeah, it's like some of those, you just can't make that stuff up. Like some of those things that you see.
No, some of the things are just so wacky. But I also just like never thought about school nursing, because I remember my school nurse growing up and she wasn't nice. Like she didn't want you in there. She always just sent you back to class.
Yeah.
And she was just like not very nice. And I was like, like, do I have to not be nice?
Yeah.
Because that lady never wanted a kid in there. She sent me back to class when I broke my arm.
Oh my gosh.
She was like, here's an ice pack. And I was like, I can't move my fingers. And she was like, go back to class. And I went back to class and my teacher was like, you can't move your arm. And I was like, yeah, I think it's broken. And she was like, go back to the health room. And I was like, she just told me to come back here.
Yeah. Oh, like, that's not okay.
What?
I think, Yeah,
and then my mom picked me up and my mom was like, you look terrible.
Yeah,
and I was like,
I know.
Thanks. That's because I got sent back to class with a broken arm.
Oh my gosh. Yeah. Oh, that's crazy.
Yeah. But it's fun. Like, I mean, some days people swallow rock. Some days it's just headaches and bumps and bruises.
Yeah.
Every time someone comes in, you do have to like fill out a little log book saying like how long they were in there. Did they go back to class? Did they go home? If you have to call their parents, a lot of times I won't call their parents, especially if they're going back to class. I'll shoot them an email and be like, hey, they were in here for this today. Just so you know. People don't answer their phones anymore anyways, so.
And it's during the day. I mean, most people are probably out at work.
Yeah, they're at work. Saves me just getting hung up on or sent to voicemails. But if people have a work email, they're probably way more likely to read that before the end of the day than answer their phone.
Yeah.
Which poses an issue when kids do have to go home and no one's answering.
Right.
You're like, oh.
That's true.
I promise they're coming.
Yeah, do you have, like, what's, if somebody, like, tests positive for COVID and, like, they're, like, where do they hang out? Like, until their parents can get them?
They stay hanging out in the health room. I have a bunch of N95s in there, so normally I'll just pop that on while I'm waiting. And the way the school's set up, the health room is by like a staircase and a back door. So if they have COVID, they can just like pop out the back door when their parents get there and leave. And then their parents don't have to come in the building just in case like they're positive too. And then most kids keep their stuff in like cubbies in the hallway, so we can just grab it for them. They don't have to go back to class.
Gotcha. Okay. You were saying you have a logbook. Is that pretty much like all the documentation piece that you do?
That's what I have to do, but for like injuries, the teacher or whoever saw the injury does have to fill out paperwork for that. So like if they scraped their knee at the playground, they'll have to write like, it's basically just a summary of events. Like, this is what happened. They went to the health room, and sometimes I'll fill out the bottom portion, like I did this in the health room, and sometimes the teacher will just be like, we gave them a Band-Aid. And then a copy stays with the school and a copy goes home. And normally if you had to fill out an injury report, like if there's a visible injury, that would warrant me to like call you. Yeah. Be like, hey, by the way,
this happened.
Like a couple weeks ago, this kid fell. I still can't figure out what the heck he was doing. He said he just ran right into the bench. He said he ran into a bench, but he had a huge lump on his head. And I was like, you were in 6th grade.
Yeah.
And the bench is like hip height. How did this happen?
Yeah.
And the teacher was trying to write the injury report. She's like, can you elaborate? Like, how does this happen? She's like, I don't know what to write because how did your head get down there? And he's like, I don't know. Just did.
Aww. Okay. Poor kids. Do you feel like, do you ever catch any like bullying scenarios that way? If like somebody's like bruised or like if they like never want to be in class or anything like that? Like,
we've caught like one of my frequent headache flyers got started on Zoloft for anxiety because she was in there multiple times a day, every day, and was just like, it didn't matter what class or what was going on, like she was just always down there. And like me and the teacher were like, wow, like she's here all the time. The teacher obviously knew the family better than I do because with this philosophy of schooling too, they keep their teacher for like 3 or 4 years to work through a couple of grades with them. So she had a good relationship with the parents and just like brought it up and was like, I don't know if something's going on at home or if there's any big changes, but like she can't stay in class. And it's becoming a problem because like you can't hang out in the health room all day, but also if you're not comfortable in class, we were just trying to get to the bottom of it. And I don't know, she had to have started a while ago because she doesn't come to health room that often anymore.
Oh, well, that's good.
So hopefully it's working.
Hopefully that is working.
Yeah. So like sometimes things like that is like the kids we've identified as like chronic not lovers of Spanish. We've come up with plans to keep you in Spanish.
Oh.
There's a couple kids that don't enjoy recess, and so we've been like, oh, why are you always sick during a recess? Like, let's have a little chat about this. And some kids straight up just don't like to be doing physical activity, and I'm like, well, that's too bad. And other times it's like, oh, well, like so-and-so is not that nice to me. And I'm like, well, why don't you try hanging out with this person instead or do this? So, yeah.
Do you feel like kids ever like confide in you as like an outsider?
They tell me the most random stuff. Yeah. Like, I know things about their families that I didn't want to know. Like, but I'm like, whoa, thank you for sharing. That's really, I'm glad that you trust me. But the fact that your 16-year-old brother wants to be a rapper and you could hear him in the shower and you hate it, I don't need to know.
Confessions. Oh.
Yeah. Or like this one kid stared me straight in the face and she's like, how old are you? And I tell her, and she's like, my brother's 22 and he's only 5'5". That's kind of sad for him, right? I'm like, it is 9 a.m. on a Monday. You do not need to roast your brother like that.
Oh, no. Kids are brutal.
But I think because I'm not a teacher and I'm in my own room and it's just me in there and it's always pretty quiet unless there's another kid, they just say whatever they want. Literally whatever they want.
That's amazing. Yeah, because they're like...
Yeah, like a kid asked me for $1 and I was like, I can't give you $1. And he's like, why not? And I was like, I'm not giving out money. That's not what the health room is about. And he's like, well, you have a dog and you don't have $1. And I was like, well, I wouldn't give you my dog or my dollar. Like, what's going on?
Like, we're not bargaining this. Like, oh my gosh. That's so funny.
Yeah. They're ruthless, but they're funny. And it's like, now I have like established relationships with kids that aren't super sick. So I get to like still kind of have fun with them, as opposed to in the hospital. We've been so short staffed and so busy that like you don't even have a relationship with your patients anymore these days. It's like, hey, what's up, Bill? Hey, here's your meds. Okay, bye. See you in 2 more hours when I come back. And like this, it's like, oh, you might only be in there for 20 minutes, but I can see you in the hallway, and I kind of know some of them pretty close because they're there more frequently, or other ones just like know who I am.
Yeah, right.
Being a private school, they don't do like school lunch. There's no kitchen, so you have to bring your own. But they keep snacks in the health room, and because they do have that opt-in program for under like the poverty line kids, some of them forget lunches, and there's no way to get you a lunch, so they have these snacks, and those kids will just come in and like, oh, hey, what's up, Saoirse? And I'm like, hey, I don't have a lunch today. And I'm like, did you forget? And they're like, no, we just didn't have a lunch today. And they just come take stuff, which is really nice that like they feel comfortable enough to just walk in and be like, no, I just got to eat.
Absolutely. Aw, I wish that they had like some kind of, I remember in school they had this program called Sealed with a Kiss. And it was like a little tray. I think it was like free trays. If you like asked the cafeteria lady for sealed, like the Sealed with a Kiss lunch, you would just get a free like sandwich tray. Yeah. Free with like a little Hershey Kiss in it, you know?
So there's no like hot lunch. So this is like the best option we could come up with. Is like, we'll just keep food, cheese sticks, yogurt.
So
snacks,
you were doing Uncrustables. Those are actually, I used to love Uncrustables and Lunchables. Those Lunchables, I could crush a Lunchable.
Now I look at a Lunchable and I'm like, that is not food.
I know. Yeah, like the little like cubes of meat.
What it's called to be meat. I was like, what? Why do we love those?
I loved them. Oh my God. That was like my favorite thing.
It was just setting our generation up to be big charcuterie board people, I think.
That was the birthing of charcuterie boards. Lunchables.
It was 90s babies and and a Lunchable.
I wanted to ask, have you done any other like outpatient or clinic jobs before? Okay. Because I was wondering like how the pay, like stipend, equates to other like outpatient jobs, or can you not really speak to that? Yeah.
I don't know. Like the closest thing I would have done to outpatient was when I was working in the ED at a children's hospital, but that was still a hospital, so that pay like related to hospital pay. But I haven't done any clinic jobs. This was like the first thing offered to me, and I was just like, heck yeah.
How much longer do you have until school's out?
They're done on Thursday.
Oh my gosh. So then
summer, that's why they're wilding out.
Right. They're like, this is almost done.
We're almost out of here. Goodbye.
Do you think you'll come back?
Don't offer me another one of those ice packs. I think so, yeah. Give it a full year run and see if an entire year I want to do it after that. Or...
Well, I'm sure it's a great little break from, the 312.
It's so nice. And the school's been really great to work with me and to like keep my PRN. They've given me like days off to be able to pick up those hours if I need to. So I don't have to work every day at the school and then have no weekend.
Okay. That's nice that they're able to work with you like that.
Mm-hmm.
Are there like other substitutes, or like do they just not have a nurse the day that?
No, they just, pre having a school nurse, they just used people in the office. And they actually just had the little health room bed in the office. They didn't even have a health room. And then they created a health room, put the beds in there. And so when I'm not there, the office just goes back to what they used to do. I don't think they move the bed, but they just send someone in there. Because some days there's no kids in there at all. So
right. Yeah. Okay, that makes sense.
It would be kind of pointless to get a substitute and then be like, hey, sorry, you did nothing.
Sit there, just in case anybody wants to swallow a rock and come in.
Yeah. Or some girl put like the bead off the end of her braid. She put it in her ear, and I was like, why did you do that? She's like, I didn't think it would fit. And I was like,
only way to know is to do it.
Yep. I was like, it certainly fits. And she was like, yeah, well, how are we supposed to get out? And I was like, you have to go home. We can't get that out here.
The tools.
She's like, aren't you a nurse? I'm like, okay, yes, but not a bead extractor.
Right. Yeah, I could see, like, if, like, the hole was pointing out, like, maybe you could, like, figure out, like, but no. It was, like, on its side.
Just a little pink looking back at me. And I was like, that's not
like,
my job.
No, we're not going to be able to do that.
No. We think we wear a lot of hats in the hospital, like, as nurses, but you wear a lot of random hats as a school nurse. Like, now I'm supposed to be a bead extractor and, like, understand what you're telling me. And, I mean, when kids are on crutches because they don't have a playground, they go out to other parks. So, like, crutches kids just hang out with me. And now I'm your buddy and your nurse, because now we're playing checkers and doing whatever. This girl, that story doesn't check out to me, but she got a bunch of burrs in her hair. She said that she just put on her hat and they showed up there, and I was like, that's strange. How would they just get in your hat? Burrs don't move.
Oh my gosh, that would drive me nuts if I only had like a little sliver of a story and I didn't have enough time to like piece it all together. We're like, you're just gonna tell me this and leave.
I'm just like matted down, burred up hair. And we had time to piece this story together because she sat in the health room for over an hour while I picked him out. And I was like, do you have a good hairbrush at home? She's like, yeah. I was like, do you have good shampoo at home? She's like, yeah. And I was like, I really need to mix it in tonight, because these are not coming out. And I was like, do you want to change your story yet? Like, how did these get here? She's like, they're just in my hat.
Yeah, right.
Who put them in your hat? Because I have a lot of words for whoever put these in your hat. Because I have the world's worst disposable comb.
Yeah, you probably don't have a whole lot of, like, resources at your disposal as far as, like, your health room. Yeah.
I have Band-Aids. Creams that I had to Google. Ice packs, which fly off the shelves. And a couple of, like, Ace bandages. And then that little, like, buy Band-Aid brand, that little like wound cleaner, which I think is just saline in a bottle, but kids think it's going to heal them. And then Dixie cups, a little bit of water. You tell them, hey, this is going to help you feel better. It's going to help your stomach. Magic. Everyone goes back to class if they get water out of a Dixie cup.
We're like, yeah, that's intervention right there.
Like, oh yeah,
water,
health room water,
hits. You know, that heals a lot of people. Water does. Water
in a little Dixie cup with like whoever's on it.
So who do you think would be a good candidate for a school nurse? Like, if you think of like an ideal, person, like what would be some strong characteristics to make like a solid school nurse?
In my head, I always used to think like, a school nurse, like you have to be like older and you just don't want to be at the bedside anymore. But guess what? I'm not older. At least I don't think so. And I did just not want to be at the bedside anymore. But I think to be a school nurse, I mean, if you want to not be the school nurse that's remembered as the scary lady that nobody wanted to go to because she sends you back to class with a broken arm, it's just a lot of like so much communicating, like via email with the students, with the office, with the parents. So you have to communicate like on an adult and professional level. And then you have to figure out how to communicate to a 4-year-old who's trying to tell you that they're whatever is not going right.
Yeah.
What?
Yeah.
That's a different language.
So a good communicator on all levels.
Yeah, and like it's nice that I'm in my room alone, because I swear if someone watched me, they'd be like, what the heck, this girl is so weird. But like kids, just you have to be weird to understand kids. Like you have to just get on their level sometimes and be like, yeah, that does suck that your brother's 5'5" and he's 20. Now let's get to the root of the problem. Like,
yeah. You're leveling with them.
Yeah, friendly. You gotta be friendly. And then I feel like organized, because between like you can't plan your day because you don't know who's gonna get hurt, but you do have like things to do. Like I have emails to answer, I have meds that have to get passed. So you just have to like be organized. Those kids definitely need their meds. And like people do need to know when they can come back to school. And just because your best friend came in swallowing a gem doesn't mean that the other things can't be done. So
yeah. Awesome. Well, I think we're going to end it here, but thank you so much, Saoirse, for coming on the show and talking about school nursing. This is awesome.
It was great to be back.
Yeah. So, all right. Well, we will talk to you soon. That brings us to the end of the show. Thanks for tuning in to Nursing Uncharted. To learn more about today's episode, make sure to explore the show notes at americanmobile.com/nursinguncharted. And don't forget to subscribe so you never miss a guest. If you're a nurse interested in traveling, visit americanmobile.com to explore the largest database of travel nursing jobs in the industry and the amazing benefits that American Mobile has to offer. Also, a special thanks to producer Jonathan Carey, assistant producers Katie Schraubman and Sam McKay, and Aiden Dykes for the music and editing. Until next time, take care of yourself.